Good morning, fellow humanists. My name is Todd Kimball. It's an honor to be an MC for you this morning. Happy Mother's Day. I see many spirited moms in the crowd. I see more family get-togethers today than normal, so it's a beautiful Sunday, Mother's Day. And again, happy Mother's Day to you all. And a reminder that humanism is a rational philosophy informed by science, inspired by art, and motivated by compassion. It advocates the extension of participatory democracy and the expansion of an open society standing for human rights and social justice. Our reader today is also a part of our audio committee, our technical committee, Mr. Jeff Strang.
This reading is titled, What I Learned in First Grade This Past Week. In Ms. Friedman's first grade class at Gilbert Park Elementary School, for a couple of afternoons last week, I got an education. The diversity of personality types was fascinating. There was a boy who couldn't sit still and was mocking and acting out and seemed older than many of the others. There was a girl I've nicknamed Ms. Distraction. She doesn't want to take part in the activities the teacher leads and does her own thing as much as possible. But she's lonely. No one will be her friend. I first came in at 12:30 p.m. on Tuesday, and she immediately glued herself onto me, talking to me and trying to get me to pay attention to her. A big class distraction. There's a girl I've known the longest, Palestine, part of a large Somali American family. I'm there especially to help her. She expects privileges and runs away down the halls when the going gets tough in math, which I guess she doesn't do well in. On Tuesday, I raced down the halls after her, caught her, and brought her back, where the vice principal met us to take Palestine to her office, where she calmed down enough to work on the test she ran off with. Oh, she was mad at me. But at least I've had many positive experiences with her at home, so it blew over after a couple of days. On Thursday, I gave her a purse of dimes and pennies and showed her how to buy and sell things. They're working on adding and subtracting up to 100 in class. I hope she'll also inoculate herself and her nephews at home with capitalism. Then there's the new girl in class from Somalia. She'd started there just 1 week before me. She didn't have any friends yet, but was very, very friendly. Limited English skills. I helped her with the difference between B's and D's. One has the belly on one side and the other on the other side. Some pregnant lines walk forward through a word and others walk backwards. In the music room where there were drums and percussion instruments and fold-up risers for group playing. But the lesson started out with body percussion, with the teacher projecting a video of someone doing different body percussion patterns instead of the teacher doing it herself. The teacher didn't stay with each pattern long enough for the kids to learn it, but breezed forward to another pattern that she also didn't let the kids learn. 4 of them. Boring. Then she did a song with hand motions. Bow, wow, wow, whose dog art thou? Little Tommy Tucker's dog, bow, wow, wow. The kids, of course, didn't know thou. That's more of a 6th grade word. What was the teacher thinking? She tried to explain it to them, but only a couple were paying attention. As an adult visitor, I was able to leave the music room early to buy and sell with Palestine before the regular class started again. Thank you.
The skin is the largest organ of the body. Few people know more about it than our own Helen Christians. She discusses skin anatomy and how skin reacts to injury, as well as how wound healing occurs. Helen graduated from Texas Women's University in 1983 with a master's in occupational therapy. She has worked at Legacy Emanuel Burn Center, and she was honored by the American Burn Association as the Therapist of the Year in 2015. She currently volunteers. She currently serves as a volunteer educator at Portland Street Medicine. She is a fantastic MC, a tireless volunteer for our organization, and this morning she serves as a dynamic presenter. Please welcome Helen Christians.
Thank you so much. I just am so glad to be here today. I'm a little nervous, just because I like you all so much and I want to do a good job. Joyce asked me to do this presentation, and she probably just needed to fill a spot. But anyway, she made me feel like it was important, so I'm going to try to do the best I can. Okay, all right. So today we're just going to be talking about the complexity of human skin, and luckily, I went over this with my husband and went with Sweet Al, and he just said, do you want them all to be wound nurses, or do you want them to just learn a little bit about skin? And I want them to just learn a little bit about skin. And he said, well, then act that way, just behave that way. I said, okay, so here we go. Right, so here's I just started with a few interesting facts about skin. And if you were to take all your skin on your body and put it into a square, it would be would weigh about 15% of your body's weight. It'd be 20 square feet. So it'd make a nice 4x5 rug. And it is different thicknesses. At your eyelids, which is the thinnest of your skin, it's just a 0.5 millimeter thick. But at your back, it's 4 millimeters, and the soles of your feet and the palms of your hands, especially if you're a good walker or a workman or woman, it would be much thicker, 5 millimeters, and even with calluses, thicker than that. It's the dermis, the base layer of your skin, that makes the change of your skin's thickness. The epidermis, the top layer, is completely the same thickness all over your body. And this is important as we go forward. All skin has hair, even though we don't see it much. Everyone, all of your skin has hair follicles, except your eyelids, your lips, the soles of your feet and palm. But Al reminded me that I'm not at a medical lecture here, but I'm with a group of humanists. And I want to introduce you to, honestly, the first humanists. They were cave people. They spent a lot of time around fire, and they recognized that they could do something to help people medically. They used evidence-based practice to try the things they found in nature. And this would have been lamb's ear, which made a great absorbent dressing. Yarrow could be turned into a tea and could help with inflammation. Aloe vera, anything that would be moist, they thought a moisture on a wound helped with the healing, and they used this evidence base to become healers themselves. It's the one organ they could get to. They might use rattles and songs and intonations and dances to fix anything else, but they could treat the skin. And this, the last one, that brown powder, the radix, that is being researched even today for its medicinal powers in promoting skin building, rebuilding the skin. And that's, they're doing some research currently on that. Historically, they also, if they could find silver was something that helped with healing, and different mosses that they could find. So those early humanists believed that they could make a difference by treating the skin. Ancient civilizations were really also, even though they may have been at temples, medically, when they treated the skin, they used, they included the fact that honey is a natural antibiotic that we use today. Meta honey is used in the burn center and only has to be changed every 3 or 4 days. Silver, which is also used medically to a salve called Silvadene, was also used to treat. Now, they didn't know why it worked, but they figured out it did. Or skin is an organ that you can treat. The Babylonians talked about in their, then we can read about it, in that cleansing a wound, cleaning a wound was so important. The land of milk and honey milk is a potable liquid. It can be drank and also can clean wounds. The early Egyptians knew a little bit about skin grafting. There are mummies that they found where they were able to move skin from a healthy part of the body to a wound to heal a small wound. So these ideas of that we use even today, millennials, many millennials ago, were part of medicine. The more familiar, the Greeks and Romans discovered many innovations. They got a lot of things wrong, but they got some things right. Hippocrates, the father, he's considered the father of medicine. He's Greek, was born 450 before the common times, and lived about 87 years. He honestly is a humanist. He took the idea that medicine, illness, disease was a form of from the gods, a punishment from the gods, and said no, there's a natural cause for disease, and the idea of treating wounds, and the idea of balance. Now, the things that he balanced were wrong, but he had the idea of the balance of mental health and physical health and hygiene and cleanliness were part of that. And then a very prolific writer, Celsus, was born first century Rome. He's pictured down there in the corner. And he wrote volumes and volumes of medical information, including keep a wound moist, wash a wound. He wrote the book De Medicina. He also found the signs, we'll be talking about this in a little bit, the signs of inflammation, and that it was part of wound healing. And those 4 signs which we use today are still exact: pain, redness, heat, and swelling. He's, if anyone's had surgery or had a wound, they will do this, these inflammations, not an infection, it's just part of healing. And he was a prolific writer as well. And then the Galen or Galenus there, he was born in 129 and lived to 216. All these guys lived a long life. They lived into their 80s. But he was a Greek, trained in Rome, trained in Egypt, which was the center of medicine back then, and worked with the emperors, was the physician of an emperor, but also the physician of gladiators. And he was able to experiment on these guys. He believed that wounds could be healed and treated. And this idea of moist treatment, using cabbages to cover a wound. He also believed he wanted to do dissection, and it was very much negative to do that dissection, to desecrate a body and figure out the inside, but he would use the dead gladiators, to secretly do these dissections. So his work, between Celsus, who we followed, and Galen, their ideas, the Dark Ages began, and their ideas of treatment, medicine, lasted thousands of years, like till the 1600s. What they wrote, the things they wrote, stayed with humans and physicians through the Dark Ages, over 1,000 years, which in some ways was good, but in many ways, because they're the guys that did bloodletting and they got a lot of things wrong. Galen also had the idea that you had to have pus to heal a wound, which meant he promoted infection. So he got that wrong. But they did get a few things right, including the idea that wounds, that disease has natural causes. And that's what us humanists believe too. This is a book that was written in the 1419s, printed, and it's called Wound Man. He's quite famous. wound man, for every wound, there is a chapter or instructions on how to take care of that wound. He's looking awfully, he's standing for one thing, which I think is really kind of funny that he's standing up. But every wound or rash, irritation had a chapter to go along with it to say, here's how to fix this. My guess is that his patient, a lot of those patients didn't quite make it. I can't imagine that their success rate was very high, but it gave him something to try. But we have been with knowing about skin as a modern science, really just very new. The idea that what our skin does for us, we know it protects, it regulates temperature, by contracting or sweating, it excretes waste, and it absorbs vitamin D. We need it. We are able through those nerve endings in our skin to perceive pain and temperature. Those feet are the perfect space away from that fire because of those pain sensations. Comfort, where the human touch gives us comfort, and it is elasticity. Every one of us in this room grew from small infants to the adult size that we are because our skin, it can stretch. And I can reach the top cover to pull out the cereal because my skin stretches. I have very elastic skin. If you look at my wrinkles on my face, my skin is quite elastic. And then it's our identity, that group of people down there. By looking at their skin, you can see so much of who they are. What are their age, their ethnicity, their mood, their general health. I mean, if you don't look so good today, it's usually the pallor of our skin or a little woozy. So our skin is a detector of disease as well. We're going to look at three basic levels of skin. There's many, but we're not getting into that. What I want to look at is the three layers would be epidermis, this top one right here, and that epidermis is very thin, and it's the same thinness throughout our whole body. It's our top layer. And the only thing that's alive on the epidermis is the base layer, the basal layer. And that is got a rich blood supply, and it's reproducing cells all the time. It's cloning cells, it's cell dividing. And as the next layer, as the basal cell makes more cells, it pushes those other ones that it just formed away from it. And it decreases its blood supply until finally it's got nothing. And that's what is here. What I'm touching right now is as dead as a doornail, it's dead. This outer layer that I'm rubbing is dead. It's dead cells. And it's the reason we change our sheets is because we're always shedding annually, we shed about 9 pounds of skin a year. And it's what you see when you scratch and you get a little bit of, we lose about 30,000 cells of skin a minute. And over time, that becomes 9 pounds. So we're always getting rid of that epidermis. It's dead. It's dead. And we're supposed to lose it. It's got some good qualities, though. It's waterproof. It's quite waterproof. If you sit in the tub, you'll soak it up eventually, but it's waterproof. It's anti-flammable. It's got some great qualities, and it's our protection. It keeps those germs of the world out there and the fluid in our body in here. The dermis is quite rich. It's big, and as I said before, it could be as thin. It could be as thin as thinner than a 0.5 millimeter, or as thick as 5 millimeters. And it is what we have. It's what we have in our skin. It is the hair follicles, the nerve endings, the sweat glands, very rich blood supply, extremely rich blood supply, and oil glands. And this one's kind of fun. It's a little muscle right here that's attached to every one of our hair follicles. And it's a tiny, tiny, tiny little muscle that when you get cold, you had goosebumps, it contracts the skin. So that's attached to every hair follicle. Let's see. And then of course there's the subcutaneous skin, and it's the fat. And some of the deeper roots of the hair are there, the deeper roots of the oil glands are there, and but it's quite deep. And the one thing I want to show here is that the epidermis, that top layer, surrounds all the appendages of the dermis, the sweat glands, the oil glands, the hair follicles. They're buried, it's buried epidermis. Everything has a thin, one cellular, just a thin layer of epidermis around it. And that's important as we go forward with wound healing. So I'm going to move on from looking at the anatomy of skin and its function into how does a wound heal. All of you have had a scraped knee, a burned finger, a paper cut, and none of you had to rush for those wounds to the burn center or to see your doctor. You just, you just got it closed. If it was serious, you needed stitches, or it was a big, of course you went to see a doctor. But most of us heal those things. We don't even think about it. We just take care of it. But all of those wounds go through four distinct procedures to heal a wound. The first one's homeostasis, the second one's inflammation, the third's proliferation, and the fourth's maturation. And it takes days if it's a tiny little wound, to years if it's a bigger wound, to go through this process. And we're going to look at that right now. Now I'm showing him as four distinct processes, but these things are going on simultaneously. One's primary. And the first one's homeostasis. It's stop the bleeding. Let's get this bleeding stopped. And there's a cut. It may be a knife, a piece of glass. Something has cut the epidermis, and pathogens are coming in. Those little blue things here. Let me get here we go. The pathogens are in your body, and the macrophages are sending out, they're these sentries that are all around our body connected to the white blood cells. These macrophages are sentries, and they send out an alert. We're in trouble. We've been breached. The skin has been breached. Pathogens are in. Blood is leaving the body. This is serious. Help, help, help. We need help. And our body responds. First, through the coagulation cascade, through our own blood supply at the place of course, there's little bleeding going on right here. The coagulation cascade sends our platelets out and says, we got to patch this hole. We got to patch this hole. And they do. They literally fibrin tissue mesh and stop the bleeding. It's just, we see that. We've all seen that. But those pathogens are still in our body. And that is a danger for an infection. Our body knows that. So the macrophages say, send in the white blood cells, send in the pathogens are there. And this begins the next stage of healing, the inflammatory stage. And that's the goal is let's clean this place up. We've got dirt here. And now the phagocytes, the white blood cells, rush to the area again through our bloodstream. And there's human growth factors rush there, and tons of other things that scientists are trying to find out that they don't quite know yet, but they're working on it. And those phagocytes literally eat the pathogens. They just eat them up. They capture them and capture them and capture them. And we were talking about this discovery of inflammation by Celsus back 2,000 years ago. This is what we're looking at, inflammation. It's red, it's painful, it's hot, and it's swollen. Now, the swelling is a good thing because it brings all those good phagocytes to the healing site. It's not an infection. There's no infection there. That's normal healing. It lasts a couple days to a couple minutes if it's a tiny little paper wound. With people of pigment, very light pigment to their skin, it's pretty easy to see, as you can see with these toes and the cut in the forearm. But to people with darker pigmented skin, it's harder to see. It might be touch the heat, and it might be a deeper color. And I'm really happy. This used to, in education, it was just, we talked about inflammation and everybody showed white people. And they're really saying, wait a minute, the darker pigmented skin is not the same. You've got to look a little deeper for pressure wounds and for more serious wounds, including there's research on after COVID with the I'm saying it wrong, but the oxygen probes that on the finger, oximeters, thank you. The people of color read a higher oxygen level. Their oxygen was a lot lower than it was really. And so they're doing research on that. This is now. This is this is now. This is happening now. But it is happening, and the classes that I teach, we're teaching to the medical professionals through Columbia Wound Care Community. We're really stressing the heavier pigmented skin has to look at inflammation. So the goal of inflammation is a clean wound bed. And if it does its work, those phagocytes capture those pathogens and we've got a clean wound bed. But now we have to begin repair, and that's proliferation. The proliferation is happening in two separate happenings. The epidermis, that top layer, is doing its thing, and that's cell division, cell division, cell division, cell division, cell division. The dermis, that base layer down here, it's rebuilding. There's no cell division here. This is need to rebuild. Here, it's cloning. You're getting the identical epidermis happening here. Here, it's rebuilding, and it's two different processes, and the two separate layers, usually they're combined. There's a tight combination between them, but in this area here where the wound is healing, they're separate. They're like, I'll do my thing, you do your thing, and let's get this wound healed. So let's look at a superficial wound, a sunburn, but not a terribly blistering sunburn. You touch a hot iron or a hot pot and you don't get a blister on that fingertip, but it hurts. There's been a burn. That's called a superficial wound, or a first degree if you're looking at an older term. And the epidermis has been damaged, but the dermis is not injured at all. And what happens is the epidermis just starts cell division, goes into rapid, there's growth hormones show up there, but it just goes into rapid rebuilding. And those, the edges where the pain is, the outer edges of the pain, they come in and say, let's get these replaced. And they rebuild the basal layer is what they end up doing, trying to find each other. Partial thickness injury, this would be a cut where you see the dermis, you see the blood, you see the burn, but the dermis isn't destroyed, it's damaged. It's most of the burns and wounds and rashes and things that you all have seen and treated without any trouble. Scraped knees, scraped elbows, that sort of thing. And in this case, the epidermis is blistered off. It's a second degree partial thickness. The epidermis it's gone where the injury is. But the hidden epidermis, and these would be the wounds that you treat at home. You want to wash a wound with soap and water. You want to rinse and pat dry, apply an ointment, and cover with a bandage. So this kind of a wound, a partial thickness injury, and being treated at home, would just be wash with soap and water, rinse and pat dry, apply an ointment, and cover with a bandage. That's all you got to do. But what the body's doing is that hidden epidermis at the bottom that's been covering the hair follicles and the nerve endings and the sweat glands and the oil glands, that epidermis is saying, we're here. We got to get up there though. We're buried. We got to get above the dermis because we're right now we're down there. And so the epidermis is working at getting cell division, getting above the dermis. And the dermis is working on repairing the tissue. And there's specialized cells. Now that the phagocytes have said, okay, our work is done, the fibroblasts show, whoops, got it wrong. Okay, go back one. The fibroblasts show up and they say, we'll be part of it. And the blood supply that's been damaged, because you've got to cut, you've damaged the tiny little arterial and venous blood supply, the little veins, the tiny little capillaries, they've been damaged. And how we heal the blood supply to the wound, how we repair it, is through a process called angiogenesis. And those little blood vessels just start to bud, and they just bud and make a new blood supply, make new veins. They rebuild the veins through what's there. They rebuild them. And that's what you're looking at right here is a wound. And you can see, I'm hoping that's red, it's bright red because that arterial blood is coming to this wound in the form of these tiny, tiny, tiny little vessels that reform, rebuild. But those tiny, tiny little vessels are so fragile. They're so fragile. They need a structure. They need something to hold them up. And the way we do this is through the fibroblasts. They're specialized cells that come to the wound, a clean wound bed. Fibroblasts work best in a clean wound bed. And they just make collagen. And collagen is what makes our skin strong. This is collagen here that is not injured. It's normal collagen. It's rope-like, it's tough. It's what gives our skin strength. And the fibroblasts here are making these tiny little fibroblasts are making these tiny little weave or a web of that they give to, they give the collagen and support those little vessels and give it strength and give it some structure so that they're not destroyed by just pressure or it's not destroyed. But what about the epidermis? So it's doing its work trying to get above this newly formed dermis, and it does. It goes vertical. Like I got to get like kind of like if you've ever been dove off a diving board and you're underwater, and then you come up, your body just says, I got to get above this water. Well, that's what the epidermis does. They're at the same drive above the dermis and say that we don't belong down here. We belong up there. And it works that one cell, up until it gets above the dermis. And that's these little yellow things are the little tiny cells of epidermis that gets above the dermis because it's there. And so it's one cell layer tries to find each other and they make a new basal layer of epidermis. And then once that one layer of basal cell is formed, then it goes horizontal and gets the skin thick again. So the epidermis that's formed is normal epidermis. It's normal stuff. The dermis is doing its rebuilding down here. And it eventually, when I'll go one back one more, when it heals, when this finishes its rebuilding, then the dermis and the epidermis start to work together as a unit, and it disappears. There's no scar there. You've all had wounds on your body that are like, well, that's gone. That's nothing. Where'd that go? You can't even find it because it just forms again, and it says, okay, let's get back together. We're doing fine, and that's what they do. But what about a full thickness injury? An injury that loses the epidermis, the dermis, it's very deep. This would be a third-degree burn, a full thickness injury, a pressure injury, like something where you were laying so long that it lost the blood supply to the skin. And you'll see this in a lot of nursing homes. They're always turning people because they're trying to prevent pressure injuries, but it's hard to do. And it's a full thickness injury where the epidermis is gone, the dermis is gone, you're down to fat, and in some cases down to tendon and bone. What happens then? Now today, these full thickness injuries are taken care of in surgery. But prior to even, I mean, in my career, so I started at the Burn Center in '86, and they were doing skin grafting, but someone that was injured with a deep burn, bigger than 50%, life expectancy, even of a healthy person, was iffy. So these full thickness injuries could be deadly depending on their size. But a small full thickness injury, somebody might say, I'm just going to let it heal. And even today, people do make the decision not to see a surgeon. I'll take care of it, and it would heal over time. So a small full thickness injury, what happens? So the angiogenesis, the rebuilding of the blood supply, right in here, it happens. It's your body says we need to fill this, and we need to fill it with skin or something. Whoops, I gotta go back one. That has a blood supply that's alive. If you don't have a blood supply, you're dead. So it's got to be filled with a base layer, a dermis, that has a blood supply. And the fibroblasts back here are saying, well, we'll make the collagen. We can do it. We can do it. And so it's exactly what it does. It rebuilds this skin. But where's the epidermis? There's nothing to come up from the bottom. And so the only place that you're going to get epidermal tissue is from the skin that surrounds the epidermis, or the skin that surrounds the wound. And it has to come from the edges. And it will. Our body will do that. In a minute, we're going to see a very, very nice wound, not a bad wound, I promise. Not a hard wound to see, that did heal without having surgery. It's possible. But the only place this epidermis can come from is from the surrounding tissue. And so our body, the epidermis is coming from the sides of the wound and trying to find each other. Even if it's a long distance, they are like, where are you? You know, like just trying to find each other, and they will over time. And the dermis is doing something really interesting in that the specialized fibroblasts say, well, I think I can make a difference. And so these myofibroblasts get in those, they come to the wound, the dermis, and say, I'm going to shrink this sucker because there's uninjured skin here and here. And that uninjured skin will stretch. If I gained 100 pounds, my skin would stretch. If an infant's skin stretches from infancy to adulthood. So the myofibroblasts say, let's shrink this wound. Let's try to shrink this wound and make the uninjured skin that surrounds this wound shrink. And it does. It shrinks about 20%. Now, that kept me in business for 30 years at the Oregon Burn Center, because with that contracture that the myofibrils were doing, if a burn crossed a joint, hands, shoulders, elbows, feet, knees, all those active places, I as a therapist worked with the patient to maximize their mobility and try to counter those myofibrils at those joints to get them moving. And also our surgeons would do releases to give them mobility after they're about a year, 6 months to a year after their wound had closed. But for a small wound, like I showed you that little circle wound, myofibrils are great. They will shrink a wound. And so with the help of the full thickness injury, with the help of a lot of components to healing in the dermis and the epidermis, you get a closed wound. It is my life's, it really is. It really, really, really is. It is my life goal to get, or burn centers, and well, burn centers do this already. Burn centers got this. A lot of wound centers say, yay, we got a closed wound. We've closed the wound. We've closed the wound. A closed wound is not a healed wound. It's not a healed wound. There's the fourth, and this is my one of my favorites of the four, is maturation. A healed wound goes through the fourth process, and it's called maturation. And it's remodeling of the wound where the epidermis and the dermis begin working together again. And in deep wounds, you're not going to get the normal skin back, but you're going to get scar. And it's great stuff it's better than an infection and what comes with it. So the remodeling can last for 3 to 12 months. And actually it continues for the person's lifetime. The body's always trying to make it better. And the epidermis and the dermis begins working as a unit. And so if you look here, this was a road rash. And it was a pretty nasty road rash with the deepest area right there, that dark, dark, dark spot. Right there, you can see the dark spot. And a year later, this is what that wound looks like. Now, this partial thickness area, it's not even noticeable. There might be a little bit of color difference, but it's perfectly normal skin with sweat glands, oil glands, nerve endings, all that stuff. But right here, where it was the deepest, is just scar. It went through the angiogenesis, where it rebuilt the blood supply, and the collagen rebuilt some strength. It's strong, but not as strong as normal skin, about 80% as strong as uninjured skin. But it has a blood supply. It's alive, but it's shrunk a little bit. It shrunk about 20%. And the epidermis from around here closed this wound. So you've got a closed wound. I'm sure it was the last part of this injury that healed. So that is the healed wound. And this is very recent, guys. We talked in the beginning about these wonderful humanists that said in concept that injury is not from the gods. It's not a punishment. It's not a hex that a witch put on you. It's not a bad luck from something my father did that's carried through our family for generations. We live in modern wound care. We are these physicians, surgeons, therapists, nurses, dietitians, all these people now work together to heal a wound. And I'm sure glad I live now, since antibiotics are readily available. But this is new. Galen and Celsus, 1400 years, people listened to them and believed in the four humors and believed in bloodletting. And that was a lot of years for them to be so powerful. It was the Dark Ages, and there was a religious ban on doing a lot of science. But modern medicine is only in our lifetime, honestly, in our lifetime. Mass production of antibiotics, I was alive when that happened. Mass production of blood banking, I was alive when that happened. Now, World War II made a lot of difference. There was blood banking, there was sulfur drugs, but there wasn't mass production of these things that we have today. So, and the whole idea of germ theory, is only maybe 200 years old, and there's still signs that I leave when I'm in a restaurant, please wash your hands. We don't have it under 100% control, but people believe in germs. I mean, thank goodness we got that. But the idea of antibiotics, that we can fight infection, and the idea of really some major surgeries. These stitches were done in surgery. These or done with a septic technique, where the doctor wore he or she wore sterile gloves, used sterile equipment that was germ-free. And so that these stitches were done so that they weren't going to get infected. They still do sometimes, but the goal was not an infection. The idea of skin grafting, where they're able to take a portion of uninjured skin and take a tiny little thin layer, epidermis, and a little bit of the dermis, and move it from the uninjured, usually a thigh or the back, or depending on where the injury is, and move that skin, the thin layer of skin, to the injured area. and the skin takes that angiogenesis that's going on there, that they want, like, we want to fill it. What's going on? We want to fill it. The skin will accept it. And the patient that at the burn center today, they go down, they go to surgery, they take the burn skin off in surgery under anesthesia. They take a skin graft, they take an uninjured area of the skin and move it to the injured area. Now that donor site where they took the skin, that heals on its own. That goes through the healing process I showed you of a partial thickness injury. Where they move the skin, if it's a full thickness injury, that will never have sweat glands, that will never have hair follicles, that will never have oil glands. It will have some free floating pain and temperature that will come back, but the skin is never the same. And now, today, there are people who have survived 95%. I attended his wedding. I went to his wedding. 95% of their body had a full thickness injury, and they are alive. They have 3 kids. They have, as a matter of fact, they have a grandchild now, which I was my honor to meet. But people are surviving these horrific injuries. If there, a lot of it is luck, a lot of it, I believe, is determination. I want to be alive. I've seen that. I've seen that personal strength. A lot of it's associated with other people that they love, that these big burn injuries survive. They just make it. And I'm really proud of that. And they're continuing to do these. There's a new process going on right now. When you do a donor site, like the gentleman with a 95% burn, 5% of his skin was not burned. Only 5% was a donor site. So they had to reharvest and reharvest and reharvest and reharvest. And he was in the hospital close to a year to reharvest. There's a new process now that they're just starting, which Dr. Schrage, who's the director, and Dr. Mueller are doing, where they are able to harvest. And you see here a kind of a mesh pattern. There's a mesh pattern that they have always put it through a mesh. That's been going on for a long time, where they are able to put it through a meshing machine and stretch a little patch of skin and stretch it so it's bigger. So in that gentleman who had a 95% injury, he had would be called a wide mesh, but it took longer for that wide mesh to close and those epidermis tissues to come in. So his between surgeries took a long time. The wider the mesh, the longer it's going to take for that graft to be safe for you to move and go and be durable. But there's a new procedure that they're just starting. It's called RECELL. And they did a surgery on a little guy. They took his back was burned. So normally you would take, it would be 2 surgeries. A full back would be two for sure, 2 surgeries to, because you don't want to take, especially on a little kid, too much big donor. You'd want to reuse the donor. And Dr. Schrage took the donor and meshed it 4-to-1, which you'd never do on a kid because it is more scar. It's just too big. It's too big to do on a kid before this RECELL started. And there's a procedure now that they're able to, and I have no idea, I'm going to learn how they did it. They are able to take a tiny little patch of epidermis, the size of a postage stamp, and turn that into kind of a slurry of cells. And I don't know how they do it, but they're doing it. And then spray this epidermal tissue that has been pulverized or, safely. Yeah, and hose it on, spray it on where all these, those epidermal tissues we were saying, that you can picture a mesh, 4-to-1 mesh is really wide. And they spray this epidermis on, and that epidermis is like, oh, great, we're here. And they start cell dividing, and they close those triangles fast. And so that this little guy, this 4-year-old, didn't have to go through 2 surgeries. He went through 1 surgery. And now the mesh appearance will always be there, that they haven't figured out. And saving a little guy from 2 surgeries is worth that, because the mesh is, you're always going to see the mesh. But in this day and age, they'll say, wow, where'd you get that cool tattoo? I love it. So that's really happening. Like, how did you do it? Can I get one of those? Like, who's your tattoo artist? That's really happened, where guys are, have visible scars that have been meshed. So the wounds of 2024, and we'll have time for questions in just a few minutes. It's a whole new ball game, guys. We can figure out how to close a wound, but man, are we getting wounds? Pressure wounds from nursing homes, or people that are, just folks, hemiplegics and quadriplegics and paraplegics used to have a 5-year life expectancy, especially quadriplegics. They had a 5-year life expectancy at max. Paraplegics a little longer, but they would die of a urinary infections, or they just didn't live long. Well, paraplegics and quadriplegics are living close to a normal lifespan, but like all of us, their skin ages. These are often happen when they're younger, and their skin ages, and if anything over 40 is considered old skin. I hate to tell you that, guys. So we're all, most of us in this room are in that, over 40 is old skin. So so the paraplegics and quadriplegics who lived, worked and had families and were driving and were busy, are showing up at our burn center, the organ burn center, with these horrific pressure wounds, because they have no sensation on their sitting areas, but their skin isn't as strong as it used to be. And so they're seeing a lot of, they call it flap, where they move muscle. They have to move muscle to cover these horrific wounds that have gone down to bone. Necrotizing infections. People died. They died from these infections where you'd get a cut and get horrific infection that would tunnel under the wound. People are surviving those. Meningococcemias, people died. These are infections that would affect the skin and a lot of other things too. People died. Well, they're not dying anymore. They know how to keep them alive and are living. But these are horrific wounds. Traumas that used to just be, go to the Civil War, where you just, you cut off the leg, you cut off the arm. That was the solution for traumas. Not anymore. It's limb salvage. There's a real push for limb salvage, where you don't take the leg or the arm, you save it. So standing on a foot, even if it's damaged, is better than a prosthesis. And elderly people are living longer. 65, they picked 65 for Social Security back in the 40s, because that was life expectancy. They thought, give them a couple of years with some money and they'll be gone soon after that. Well, that's not happening, where people are living well into their 90s, 100. And also then chronic diseases, diabetes, with the loss of sensation to the feet. You get these horrific wounds to the feet. Venous disease, where you get the swelling in your legs as we age, and discoloration. It's because the blood is having trouble getting back up our bodies. And so wearing compression stockings and doing some pumping and things like that are treatments for that, but it's also associated with a lot of serious diseases. And chronic lung conditions, where you're getting this heavy swelling in the feet associated with wounds that are being treated now. So we are saving a lot of lives, keeping people alive, but it comes with the need to care for our skin. So I think, those are my references. And I think I'm available for questions.
Helen, that was an outstanding job. Beautiful talk this morning. Very informative. I particularly enjoyed the history of wound care and showing the early humanist. And you more than accomplished your goal this morning. Those of us who weren't nurses coming in are not nurses now, but we're all smarter. Excellent job. And your visuals were good enough. They were very informative. I will let the Zoom community start with our first question. Hank Robb, had a good question coming into the chat during the middle of your presentation.
Mhm.
And he writes, how does one tell the difference between inflammation and infection?
That's a good question. They first of all, inflammation is timed. So if it's an appropriate time for inflammation, it would be early. You've stopped the bleeding, so now it's time for inflammation. And if it's prolonged, they will do what's called a culture, and they'll take they clean the wound really well, and then they take a teeny little bit of the skin and send it in to the lab and say what's there. If inflammation is lasting a long time, then the chances of an infection are high. The body's trying to clean the wound bed, and maybe an infection has started. Some of the signs of infection are excessive drainage, excessive pain, excessive redness, and excessive heat. So if it's beyond a centimeter or two from the wound and the redness is bigger than that, then we know there's infection. But it's what happens so often is people will go in and start getting antibiotics. They don't need antibiotics. It's inflammation. It's healthy. It's normal. There's no infection. It's inflammation, and that's why we stress the idea of inflammation.
Okay. 3 questions at the Friendly House. They are much more important than my question. Let's go to question number 1 at the Friendly House.
We're all getting older, obviously. What's the correct thinking on being exposed to sunlight because of the vitamin D, and not just sunburn, but the effect on aging skin?
Yeah, the sun is your enemy. Aging skin doesn't have, especially us. I mean, I have a very light pigment. I don't have sun protection. I came from northern climate, came from Ireland, and I have no sun protection.
Avoiding the sun during the hottest part of the day, but that's.
Well, no, I mean, any sun exposure sun exposures our enemy. I mean, yes, I'm out in the garden. I'm out in the garden, but I wear a sun hat. I wear long sleeves. I don't get in the sun because I just don't have the sun protection. Now, some people do. I have a friend whose ancestors come from northern Italy. She's got more sun protection than I do, but it's individual. But still, all of us need to protect. Even the folks with the deepest pigment need to protect from the intense rays of the sun. Yeah. And all of us, I take I hate promoting vitamins because it's like, I don't have, but I do vitamin D because we don't get the sun. I mean, we do today, but it's pretty rare, guys. Maybe a couple months out of the year. Thank you, Giannis.
Joyce has a question in the Zoom that was similar to mine. She wants to know your recommendations for skincare after 40. Is just cleanliness enough?
Joyce, I hate to tell you this, but cleanliness and a little bit of lotion, it's dead, guys. I mean, you're treating dead skin. I'm sorry. I mean, but the $1,000 that people pay for all this stuff, it doesn't work. We're all going to get old, and we're all going to lose our elastin fibers, and Vaseline works as good as any Siri. I mean, I'm watching this thing now about creepy skin. I've got it all over my body where it gets wrinkled, like kind of chicken skin or whatever, and how it can, if you do this for a year, I thought, yeah, well, there's it all this expense. I said, yeah. And in a year, your skin's not going to look one bit different than it did. Maybe a little more moisture, but no. Drinking water and, hydrating and being clean. That's how you take care of your skin, and a little bit of lotion, because it's dead. So give it a little moisture, but epidermis is not alive.
The questions are multiplying at the Friendly House. Let's go to question number 2.
Hey, my question is, in the case of a severely burned person,
Yeah.
you're 90%.
Yeah.
Where you can harvest the graft area. what about the rest of the area? Is he covered with
I'll tell you.
gills of skin?
Yeah. So what they use, you're right, Jim, thank you. That's a really good point. So when you get burned, they go down and get rid of the dead skin as fast as they can, these big burns, and because that's toxic. There's an source of infection. So they really work at getting the wound as clean as possible.
And what they put on, they used to put Jimmy Dean's pork sausage, pig was the donor, pig skin is the closest to human skin. So when I started my career, they would use pig skin and cover this body that was had been excised of the dead tissue with pig skin. Today, they use so they use human cadaver skin. It lasts, and the body usually it'll take, they use the word take, that they try to make a match. And often the skin will take for a little bit, and which helps with the recovery, because they've got a cover now, and so the body's not as inflammatory. But because then the skin is rejected after 2 to 3 weeks, the body says, "This isn't us. What is this going on here? This isn't us," and it rejects it. And so they'll put on a fresh layer. The next surgery, they'll put on a fresh layer of the cadaver skin. They call that's called ALLO allograft. And so even at advanced ages, not super advanced, but older people that have healthy skin, if they use a donor, if they say, "I'd like to be a donor, my eyes or my organs," and that, they will take skin from donors, and it's very good use of your tissue after you don't need it anymore. Yeah.
Thank you, Helen. You just never know what you're going to get in our question and answer sessions. The modern day skincare expensive remedy industry, not a fan of your answers. Jimmy Dean pork sausage, they're kind of happy with you. So
Yes.
that's good.
But we don't use that anymore. They moved on to cadavers. Yeah.
Okay, let's go to question number 3 at the Friendly House.
Yeah.
Collagen supplements worthless or not?
Collagen is a protein.
Yeah.
So if you have protein, if you have
Adequate protein, I think that's will make your collagen. Again, it's if you read those supplements, the fine print, this does they somewhere they'll say this is not a diagnostic. This is we're this has not been tested. So you've got to be careful you don't get too much protein in our body. So my answer is eat well. Your food is your medicine. Your food is your medicine. I mean, my God, I mean, your beautiful gardens, Martin. I'm preaching to the choir here. Yeah, that's right. That's right. But you enjoy it. You enjoy it.
In the store, there's just lines of collagen on the shelf.
Yeah.
I see this stuff. I just curious.
now all those supplements.
If you look at the fine print, and it's that this is not not assured to be a diagnostic, or not assured to be a remedy. They always get it in there somewhere because it's not tested. All these supplements are not tested. They're not tested. They're not scientific. If you listen, it's all a testimony. It's testimony. If something is being proved by testimony, it's not true.
Yeah, so my question is about piercings. So, earlobes, tongue,
Yeah.
lip, nipple, whatever.
Yeah.
So I imagine it becomes epidermis.
Yeah.
And so you can slide
You're
almost in and out of an ear
right.
piercing. So do you have any comments on wound healing after a piercing?
It's just it goes through the 4 stages, and that's why they'll say leave it
Like they do a sterile post, and they'll just say leave it leave it in, don't take it out. Don't put any, I think they have you put a little bit of ointment or oil to keep it moist. And that's important. You don't let wounds dry out. Dry wounds don't help the epidermis close. Moist wounds, not wet wounds, moist wounds with an ointment. That's why you put an ointment on. And it doesn't have to be antibacterial. It can be clean Vaseline, works great. But you want to keep a wound. We proved that, the scientists proved that back in the year 1. And when your mother says, no, just leave it open to the air, she's wrong. The wounds heal from within, not from without. So keep the wound moist, keep it clean, and watch for infection. But inflammation is to be expected early. So it will be painful, it will be hot, it will be a little swollen, and it will be red. And that's how a wound heals. Right.
Before we get to question number 5 at the friendly house, Lori Benton in Zoom writes, can you recommend a sunscreen? Vaseline is petroleum based, isn't it? CeraVe, I think I'm saying that right, has been recommended to me.
So what was recommended?
CERAVE.
Yeah, well, the thing is using, I say Vaseline because it's the cheapest thing on the market. That's why I'm using the word Vaseline. But it's not a sunscreen at all. No, there's no sun protection in Vaseline. But just getting a sunscreen that works for you. I mean, that's the key, is finding something that you're not getting. You're wearing a hat, wearing protective clothing if you're going to be out in the sun a long time, and just finding a good sunscreen that works for your skin, testing it out and making sure it doesn't give you a rash, doesn't cause inflammation, irritation. Yeah.
So it's very much individualized. There's lots of good sunscreens out there. Kind of depends on the person's body.
Right. But the key is use it.
Let's go to question number 5 at the friendly house.
There's one word that you didn't use in your history of burn treatment, and I wonder why, because it comes up when I'm reading history of blood and guts. You hear this word a lot. Why did you not have to mention gangrene?
Oh, I didn't mention gangrene because I promised Joyce I wouldn't show gross photos.
When did gangrene stop being a thing?
It is not, a gangrene is
Much a part of medical treatment today. Very much a part. Gangrene is necrotic tissue, dead necrotic tissue, smelly. It has to be treated. It often means amputation, especially if it's into the bone. But gangrene is deeper. It's not skin. Gangrene is not skin. I mean, it can be part of the skin, but when you have gangrene, it's deeper. It's into the muscle and the tendon and the bone. And where eschar, would be an equivalent, the word eschar would be the equivalent word to skin. So eschar is, especially after a very severe burn, it's this black skin. It's just black and dry. And so that would be equivalent to gangrene. Gangrene is often associated with the foot, and it's so deep that the bone has been damaged, infected. But that's happening. Yes, it's not pretty. Yeah, so I think
so we can thank Joyce for toning down the visuals. Al tried to take us off course, as he sometimes does, but we're still hungry this morning.
That's right. Okay.
Hank Robb, a prolific writer in Zoom today, asked a question. We have 2 more questions at the Friendly House, but I'll get to Hank's question here before the last 2 questions at Friendly House. He writes, I understand mineral-based sunscreen is preferable to chemical sunscreen. Do you have any information about the difference?
I missed the question, Todd. Try it again.
Sure. I understand mineral-based sunscreen is preferable to chemical sunscreen. Do you have any information about the difference?
I don't. I would really just, with selecting a sunscreen that works for you or your family members, you test it and see if if it causes any skin irritation. But I would look, I'd be happy to look at that research, Hank, if you send me something.
Sounds good. Let's go to question number 6 at the friendly house.
Again,
Okay.
as we grow older, we're really prone to bruising.
Yes.
I mean, I feel like sometimes I look at the hand and it's bruises, and I realize that's the blood vessels, but is there anything that help prevent other than
It's
not
protection.
doing anything?
Yeah, protection. It's just, it's wearing gloves, work gloves when you're working. Our vascular systems just get.
We have the elastin fibers I was telling you about. We don't rebuild our elastin fibers. So that nice tight skin that we had, with this rich blood supply, after 40, it starts to break down. I mean, we're set up, guys, that as long as we can produce other human beings, they like us. The world likes us. But once things start aging out, it's like, well, let's get ready for the next generation. I mean, it's what happens to our bodies. And I think they're trying to figure out how to prolong health, good, vascular systems and that. But, it's very rare for somebody in their 20s to have cardiac issues, circulatory issues. It's very common for people that are older it's just what happens. Things start to break down. So no, wear gloves, Deanna. It's all Deanna. I'm sorry. That's the only thing I know. And I do it too. I mean, sometimes it just ruptures without me doing anything at all. Yeah. Yeah.
If we have time today, I'll ask the last question. But before I do that, I will go to question number 7 at the friendly house.
This is kind of what would you find in question?
Uh-huh.
If you were to remove a millimeter of skin
Okay.
from each, what would you find?
You find,
In terms of identity through color.
oh,
A good question, because all the color is in the epidermis, which is less than a millimeter in thickness. It's you figure at the eyelids are only 0.5 millimeters, a half a millimeter. So the epidermis is thin, and that's where our pigment is. Our pigment is in the epidermis, a millimeter of epidermis, probably a quarter of a millimeter, whatever that is. We're all the same color, and that's once you get rid of the epidermis, that's red. We're all red after that. It's all the arterial blood. So yeah, it's such a shame, but it's what we see. It's what we see, and we've been trained to see it. I mean, the truth is we've been trained to see it. But yes, color pigment is in the epidermis. You're right. We couldn't tell. You couldn't tell.
I'll ask a final question today. Helen, there's such a outstanding presentation and a spirited Q&A. I'm going to ask a tough question today. I think channeling your husband for the final question. One of the things I enjoy about humanism and science and your presentation today is looking at history and saying, what did they get right and what did they get wrong? And what have we learned in 100 years, 200 years, that kind of thing. So what do you think is happening today in skincare where you say to yourself, well, maybe we're right about that, maybe we're not? If there was one thing you think going on that we're unsure about, what would that be?
The complexity of wound healing. We break it up into four processes, but they're really learning that it's thousands of processes, thousands of little things that have to happen to get this to heal, and they're desperately trying to figure that out, but they've got the basics. They've got the basics of it. Basically the same basics. I mean, Celsus figured out inflammation 2,000 years ago. We're still there. We've got proliferation. We picked that up, but we don't understand how we rebuild. What really happens. We know the basics, but not the complexity. And then the maturation, is the key to long life in there. I think it is.
Sounds good. Good note to end on.
Yeah. Thank you.